dealt with medically. And so once we had the results of the head CT and then the neck CT as well, it was felt that the next appropriate step in his medical care would be to be transitioned to the intensive care unit for them to take over care.
Why was it that surgery was not an option to help Callan in this situation?
Yeah, the neurosurgery doctors were there to sort of help us make that decision. There was no significant bleeding, for example, that would need to be evacuated. There was nothing that they felt from a surgical point of view would help alleviate the problems that we saw in the CT.
Okay. And so was his care transferred to the ICU?
That is correct.
And once Callan was transferred to the intensive care unit, did your care for him end at that point?
Correct.
I have nothing further. Thank you.
Thank you. Mr. Reddington?
No questions. Thank you.
Oh, thank you, Doctor. Please step down. Thank you.
Commonwealth calls Dr. David Casavant.
Good morning, sir. Raise your right hand to the clerk.
Good morning. You solemnly swear that the testimony and the evidence you shall give to the court, the adjourned, and that in all times between the Commonwealth and the defendant class shall be the truth, the whole truth, and nothing but the truth, so help you God. Thank you. You may have a seat, sir.
Watch your step there, sir. Thank you, sir.
All right. Good morning, Doctor.
Good morning. Good morning, Honor.
Attorney Sprague.
Thank you. Good morning. Can you please state and spell your name for the record?
Surely. My first name is David. My last name is Casavant. It's spelled C-A-S-A-V-A-N-T.
And your date of birth, sir?
5263.
What do you do for a living?
I'm an ICU physician at Boston Children's Hospital.
Can you briefly describe for us your educational and training background?
Sure. I went to college out at Holy Cross in Worcester and then to medical school at Boston University. I did my initial pediatric residency at Mass General Hospital, and then went back and did a fellowship in ICU medicine at that hospital as well.
And where do you currently work?
I currently work at Boston Children's Hospital in the medical surgical ICU.
And how long have you worked at Boston Children's Hospital?
18 years.
And have you always worked in the ICU there?
Yes.
I want to direct your attention to January 26, 2023. At that point in time, did you take over the care of a patient named Callan Clancy?
I did.
And prior to taking over the care of Callan Clancy, did you do anything to familiarize yourself with his treatment and care?
Yes, I did. One of my colleagues had taken care of him the day before in the ICU. And I spoke with her, and so I was familiar with his case.
Okay. And did you also review reports and testing that had been performed while he was at the hospital?
Yes, I did.
Okay. And after reviewing the reports and the test results and speaking to your colleague, can you tell us what you learned from all of that?
It seemed that Callan had a severe neurologic injury. Based on both testing and the examination that I did at the time.
And when you say a neurologic injury, is that a brain injury?
It's a brain injury, yes it is, yeah.
And did you review specifically a head CT scan of Callan?
Yes, I did.
And what did the head CT scan show you or tell you about his condition?
The head CT is a picture of the brain, which was done in the emergency room when he was admitted to Boston Children's Hospital. And the CT scan showed an enormous amount of swelling of the brain itself. And
that the swelling of the brain, is that medically significant?
Very much so. When you have an injury to the brain that is caused by anoxia, which means a lack of oxygen, I describe this with families that the injury is very much like being out in the sun. You don't notice it at the time, but swelling occurs over the course of time. And one of the things with a lack of oxygen to the brain is the injury occurs and then swelling starts to happen over the course of time, typically peaking at 48 to 72 hours. When you see swelling that happens that early in a case, as in Callan's, it means that there's been a very significant lack of oxygen and therefore injury to the brain itself.
So, for example, some types of injuries that would withhold oxygen from the brain would be more mild and the swelling would occur over time. Is that correct?
That's exactly correct, yes.
So if a severe injury happens that withholds oxygen from the brain, that's when you see that immediate swelling like Callan had?
Very much so. Sort of the comparison of a sunburn to a burn that you might get from a stove. This was a stove. It's very, very profound.
Did you perform a physical examination of Callan?
I did.
And what did you observe?
Well, one of the first things that I noticed as I approached him was that he had a breathing tube in place, and I knew from my colleague that he was not on any sedation, which is very difficult to tolerate, having a breathing tube through the vocal cords if you're not sedated, and he was not sedated at the time. The next thing is that when I approach a patient in their bed in the ICU, we always start with a quick introduction that we're going to be coming near them in case they're asleep. And I usually start with something along the lines of, I'm Dr. Dave, I'm just going to listen to your heart. And I'd usually address them by name and to see if they start to respond. And then I'll go ahead with the rest of the exam, but that's just to sort of warn them that someone might be touching them. And then they'll listen to heart, lungs, and then to move forward to see if how responsive they are. So if you get no response at all from the initial, just using your voice, the next thing is and then from the exam, if they don't move around, then you start to sort of think, well, let's see how responsive they are. And so the next thing is sort of a gentle touch off into the bottom of the foot to see you stroke the bottom of the foot and you see if they pull away. And then you can move. If you get no response from that, we'll do something that's a little bit more noxious or painful, where you can sort of pinch a little bit of skin to see if they start to react, or pushing on the fingernail and the nail bed pressure, which is actually very noxious. And if you can see several types of response, either no response, or you can see a very specific response where they pull away from that area, and that's a specific, or you can see generalized response, which are all sort of graded along those that are as we're sort of getting a sense for what their level of consciousness was.
So if I could go over a few of those things that you just mentioned.
Sorry.
You said that that the first thing that you noticed that